Hello, and welcome back to the Calm and Connected podcast. I'm your host, Janine Halloran, and today on the podcast, I'm doing something a little bit different. I recently got a chance to interview Ted Quinn, the CEO of Activate Care, and I wanted to share our conversation with you. We talk about the pandemic and the impact that it has had on mental health and education, and how important it is for people to work together to support those who need help, and ways we can make that easier. I wanted to just give you a little FYI. We do discuss suicide in the first part of our interview, so I just wanted to let you know that in case this was an area of sensitivity for you. I hope you enjoy our interview. I am so glad to have Ted Quinn from Activate Care here with me today on the Calm and Connected podcast. So, Ted, if you could just take a few minutes and tell us a little bit about yourself and what got you interested in education and mental health.
So my background is for the last 25 years, I've worked in technology and healthcare. I'm fortunate that I've been able to rub shoulders with a lot of people that are trying to tackle pretty simple challenges, but very impactful challenges in healthcare. Organizations that are trying to tackle things like hospital-acquired infections, who drive significant number of fatalities in the US and around the world. Organizations that are trying to think differently about patient workflow or provider workflow, and how these, if you will, stakeholders in healthcare that are so central to outcomes we want to see interact and interface with each other. And now with my current venture and the things we're pursuing, the mission we have at Activate Care, we're really much focused on how do we connect it, all the stakeholders and players that are touching individuals and families that are impacted by these challenges. Every one of us has been touched by this challenge in many ways. I know in my own life, unfortunately, a number of years ago, I had a member of my family that took their lives tied to mental health and challenges with their mental health. And despite the many efforts and the resources we were able to bring to bear, at the end of the day, it just didn't prove sufficient to overcome a pretty tragic situation, which obviously has implications for us as a family and individually a few years later. And, we were aware of that situation, and we were trying to actively work it to have impact on that experience and try to get a different outcome. And we know, unfortunately, many individuals and families struggle in silence as they try to cope with and manage issues that are not well diagnosed or addressed. And so we're really driven as part of an organization to say, how can we have impact and help these individuals and families, where it often takes a significant amount of resources, but people who can come together to try to get a different outcome and help communities, individuals have a higher quality of life.
Yeah, I think that is such an important thing to try and do. We work so hard as therapists, as helpers, as educators to try and figure out what we can do to help. But it's really hard when not everybody can communicate together. Not everybody has the same information. And so to find a way that we can all sort of be interconnected is huge, huge. Yep. So as you know, right now we are in the midst of a pandemic. We have been for a while, and it feels like it's been forever. So I was wondering, what have you seen in terms of the impact that the pandemic has had on mental health?
Well, it's interesting. There's some very practical things that we see. I don't know about your community where you live, but I know that in my community, just northwest of Boston, a lot of families are rethinking being where they are right now, right? And in terms of I came for a community for school. I came for a community for the support network. I came to a community because of commute. I came to community so I could work with people with my shared vision. And now everybody's isolated. And those drivers which drove me to be where I was on so many fronts, professionally and personally, and even from a geographic standpoint, are gone. And that's caused people to step back. And you see that begin to exhibit yourself. I'm sure you see this as part of your clinical work, where there's concern about job stability. And certainly here in Massachusetts, where we are, with the governor, with the moratorium on evictions kind of ending this weekend, implications for housing and things that might be in arrears that people have to cover, changes that we see in sleep habits and patterns, and what's happening with their kind of chronic conditions or kind of just general underlying mental health issues, all these things that the WHO and the CDC talk about, we're seeing a real amplification of. And so when I interact with friends and colleagues, as part of my work, I try to also work as a caregiver. And as I see, needs that people have around a range of challenges in their lives, there's often this component of how do you think through and help them manage these stressors that, when amplified, like the pandemic like this, really make it much more difficult for people to cope when they're trying to connect with those values and communities which have been the basis for, if you will, where they've been. So for us, as part of our work, everybody's trying to say, how do we tackle these issues? You know, you have cases where somebody gets a COVID-19 diagnosis, and they ask us, well, what do I do? And we'll see a healthcare provider. But if we want them to do the right thing, often they're trying to manage that by themselves. And how do you provide meaningful services and supports from a mental health standpoint, but also from a practical standpoint? Food, security, the opportunities to connect with people, those supports. Those are the challenges which are amplifying this mental health challenge as people sit in their basements, in their bedroom, alone by themselves, trying to manage what is a very stressful environment. And certainly when you see, people who are at high risk for this kind of severe illness, or family members caring for other family members, or people that are essential workers, not only kind of in healthcare, but food delivery, gas station attendants, all these people, truck drivers that have to go to work to support the system, and just the stressors and concern of trying to maintain my job and my income in the face of the concerns and risks that I feel about the virus. So it's very real. We talk about escalating homelessness. We talk about escalating food insecurity needs. We talk about escalating in-home supports. We're talking about mental health challenges, but we're not talking about the how and the why, and how you make it actionable, and simple things that we can do to help people when they find themselves in that situation. That's not to suggest that everybody can simply be a clinician and support people like you do through your work, but there are simple supports that we can put in place in our communities to provide those services when people are facing these challenges, for sure.
Yes, absolutely. And the food insecurity is one that I think about a lot, especially when it comes to education, because so many of our kids do get meals from school. So I know in my community, they've been giving out boxes from the USDA so that they are getting the food that they need. And that's one of those practical things that I really love to be able to see happening in my community, and hopefully in other communities as well. Because if you're not taking care of those lower order needs, kids can't learn. Kids can't do the things they need to do. If they are hungry, if they are tired, it's not going to work. So anything else that you've noticed in terms of how the pandemic has impacted education that you'd like to share?
Well, just been interesting. It's interesting to see how differently communities have approached the question of the pandemic. And I don't mean to criticize those. It's just so varied. So in my community where I am at, we've been a remote learning model for the last couple of weeks, moving to a hybrid model. Some more communities and districts within our geography have just gone right to a hybrid model. And that's introduced a lot of challenges around, kids needing appropriate breaks, taking the time to kind of change the topics and their minds around specific parts of a curriculum, or giving them opportunities to socialize in an appropriate way. And that's really, really challenging for kids. I'm the father of 6 kids.
Wow.
And I have a number of them in my home, and I see the different approaches they have for moving through the pandemic. And I see wins and I see losses in terms of how I think we're moving through, and that we can do a better job as parents, and the supports in the community with schools can do a better job. At the end of the day, I think people want to and are trying to do the right thing, and I hold on to that. But I also have to recognize that as you look at different kids and different individuals engaging in their education in this pandemic, we've got to be flexible enough to recognize the stressors we're introducing and providing the appropriate breaks and supports to help them get the outcomes that we want to see. And it varies by age. I don't worry as much about my 8-year-old who's going to have another 10 years of public education in my town versus my son who's a junior in high school, who's at a very critical point from an academic and from his pursuits in his life that he's been doing for a number of years. And so we've got to have the flexibility to acknowledge both how we measure how they're doing from a performance standpoint, but also to recognize the flexibility of how we load them with the work they have to get to what the outputs we want to see.
Yeah, absolutely. I
I would agree with you that it's so interesting, you know, all of the towns around us and our own town have done such different things, and it's been so varied. And even within my own house, we have two kids, and, you know, one is doing really well and flying solo and doing it all. And one is really needing more struggle,
Right.
having more struggle, needing more support. And it's within the same town, within the same sort of structure, two different kids, two different ways of coping, two different needs of, you know, how much do I miss my friends and how much do I manage, you know, online stuff and taking breaks. It's really, really tricky. It's very, very tricky. The pandemic in general has been, I think, eye-opening and life-changing for everybody, but just in terms of thinking about how we can support each other, how we can help each other. So I want to just focus on Activate Care for a little bit. Can you tell us a little bit more about Activate Care and how it can help us?
So Activate Care is an organization where we're a mission-driven company, a public health company. It's focused on helping communities that are trying to stand up models of care where you have disparate service providers or stakeholders that surround an individual or family to achieve a specific outcome. So the example we always use, one of my co-founders had a fairly complex health history, cancer survivor, stroke, diabetic, heart attack, a range of in-home supports. You know, who owns that problem? Well, he does, or he did. He unfortunately passed away earlier this year. And as you look at families, particularly with complex kids, who have a range of not only health issues and mental health issues sometimes, but also social needs, how do you provide a shared space where everybody that touches that individual or family can see each other and be aware of what you're doing and what I'm doing, such that we can focus on what the goals and the outcomes that individual or family wants to see happen? Those are our people. That's what we're trying to do. So we often work with communities, sometimes delivery systems or paying organizations, payers, insurance companies that have responsibility for a population, and they target a specific goal. I want to focus on mental wellness. I want to focus on homelessness and food security in combination either with another social determinant or potentially a health need. And how do you provide that shared space where they can work together to achieve the outcomes we want to see, which is better health within the community, better health for that individual and family? And so there's a technology component to what we do. There's services around instantiating meaningful workflows. I'm sure you see as part of your work, you have a series of steps you walk people through as part of an intervention and based on your experience and training. Likewise, in the face of these very complex individuals or challenged individuals, they have a similar set of interventions we can deploy, and we need to track it, measure it, monitor it, improve it. And as we do that, then we can scale it. You know, as we were talking a little bit about the pandemic, we all are aware of the escalating needs that we've seen around the country with higher unemployment and concerns about homelessness and other specific social needs. We've got to be able to measure that and track it and scale such interventions that can help us achieve the outcome we want to see. That's what we're focused on.
I love that. I think it's so important. And I think about the kids that I typically work with, I used to work with in schools, and it was never simple a lot of times for those really complicated, complex, I would sometimes call them my frequent flyers because they were in my office frequently. And, you know, how do we manage? And it was a challenge even as a school system to sort of sit down and be able to get on the same page and understand and what goals are you working on and how can that work together. And I saw some amazing things when we were able to communicate, when we were able to work together. I mean, we would sometimes run groups. I would run a group with a speech and language pathologist, with the OT. It was really interesting to you know, cross discipline, have those conversations and have those interactions that can really support, because we're all working for the same cause to help the child,
and
to help them.
It's so interesting how often you're not aware of each other, right? And I think one of the most interesting challenges is often you don't know the other people that are working to care for this family, and being aware of each other really helps you, as I think you've excellently pointed out, helps you achieve the outcomes and facilitate the kind of communication that gets the type of outcomes that's meaningful to that individual and family.
Yeah, absolutely. And there's such power in sitting around a table or having a way to
Yes.
communicate on a regular basis where you can
Yes.
actually say, this is what's going on. I found this thing that worked. Here you go. That's
That's
what
right.
I would always want to say, like, I found this and it helped,
Yeah.
or gosh, this didn't work for me. Did it work for anybody else? Like just having the opportunity to really dig in and focus and try and figure out what the problem is and come up with solutions and really look at it and see how we can help. So if people want to learn more about Activate Care, where should they go?
So our website is activatecare.com. That's the easiest way, or info@activate.care.com is a website people can turn to. We do a lot of publishing on obviously the internet. We're fortunate to work with different partners and organizations and communities around the country that we can highlight a lot of these programs. It's so interesting. I think so many communities have similar challenges in the work they're trying to issue. And I think part of our mission is to say, how can we elevate and give better visibility to how people are trying to tackle these issues? We don't claim to have all the answers, but we think we have an interesting perspective. And with our partners, we've been able to see how they've been able to have bigger impact within their communities and scale programs that are trying to get the outcomes we want to see.
That's lovely. So thank you so much. I have just one more question for you. What do you like to do to take care of yourself, or what are your coping skills?
So there are three things that I like to do. I am a big cyclist, physically, unfortunately, but also I like to cycle a lot. It's an activity where I have to focus on what I'm doing. It really clears my head, and there's a social component with people I ride with, but it's nice to give the physical exercise. It's a very practical, once again, a practical thing you can do in this environment with a mask, where you can be safe and get out and kind of exercise and clear your head. I'm a big believer in service. I try to devote 15, 20 hours a week, every week, of just trying to help people in need and serving in my community. Getting outside yourself and trying to extend yourself to help other people really helps me keep my perspective, but also have some credibility in the mission I'm trying to work on, right? Be able to say, I've been at that food bank, I've provided supports for this specific need. And that's not to be showy, but it's just, I feel like you've got to do the work to have the credibility. My wife is a musician by training, and over the course of COVID, I've been taking up the guitar. Music is very soothing. Once again, a very practical activity. I wish I had more time to do it, but learning this skill and doing something that really kind of takes my mind, once again, it kind of clears my head and helps me focus on something that hopefully someday I'll be good enough to give back or want to share.
Yeah.
Those are the three things that I try to do.
Thank you so much. I always like to highlight that because I think we talk so much about, taking care of families, taking care of our kids, taking care of the people in our community, but we also need to make sure that we're taking care of ourselves. So I just want to always highlight the things that we are doing as helpers, as supporters, to take care of ourselves as well.
Well, that's wonderful.
Thank you so much for taking the opportunity and the time to talk with me today, Ted. And I wish you have a great rest of your day.
Thank you. Stay healthy and be safe.
All right.
I had such a great time speaking with Ted, and I love that he shared what he does to take care of himself. Self-care really does matter. I plan on doing some more interviews on the podcast in the future, so if you have any suggestions for guests, please feel free to contact me at calm@janinehalloran.com and share your thoughts. If you like this podcast, please take a moment and rate it 5 stars wherever you listen to us and give us a review. And please don't forget about yourself. Take a few minutes, have a little fun, and have an awesome day.